everyone. Thanks so much for joining us today. Thank you for joining the Mental Health Commission of Canada on our webinar entitled Measuring Progress, Resources for Developing a Mental Health and Addiction Performance Measurement Framework for Canada. This webinar is being hosted by the Mental Health Commission's Knowledge Exchange Centre. My name is Brandon Hay and I'm a research and policy analyst here at the Commission, and I will be moderating today's session for you. We're glad you could join us. Before we begin, I would like to outline a few housekeeping items for you. You can download today's webinar presentation right now by clicking in the download file box located in the top right-hand side of your screen. This webinar is also being recorded and will be posted with a French translation of the slides on the Commission's website within a couple of weeks. If you're experiencing any technical difficulties, please contact Adobe Connect with the number on the screen. We also ask you, again, to kindly mute your telephone line so that we can minimize the amount of echo on the line. If you have any questions or comments, please type them in the chat box below, which is located also on the bottom right-hand side of the screen. We have received a number of questions from you throughout the registration process, which we have tried to incorporate throughout the presentation. There will be a bit of time for additional questions at the end of this webinar as well. We're also committed to responding to your questions in written format after our time with you today. The main goal of this webinar is to provide you with an overview of our new report titled Resources for Developing a Mental Health and Addiction Performance Framework for Canada. But before we delve in further, we'd like to get a sense of who's in the room and learn more about your own level of experience with performance measurement. So first, we'd like to get a sense of where you are from. Give it a couple more seconds to let this populate a bit further.
Yeah, that's yeah.
So we have a lot of people from Ontario, some people from BC and Alberta, a little bit of representation on the East Coast as well. That's great. Now we'd like to get a sense of what you do professionally, how you self-identify in a professional sense. And again, just choose the option that suits you best or that you most or strongly most identify with. So a lot of others I see. I'd be curious to learn what that might look like. Systems planners or clinicians, some service providers, policymakers, researchers. And lastly, we'd like to get a sense of your level of experience with performance measurement. So there's pretty good representation across those different levels. I see a lot of people identifying as having some experience and some identifying as having very little, which is really great, given some of the content that we've prepared for you today. I am now pleased to introduce our guest speaker for today's presentation, Dr. Élaborer. Dr. Élaborer has a Master's of Science in Healthcare Research and a PhD in Epidemiology. She's an adjunct professor in the Department of Psychiatry and Community Health Sciences in the Cumming School of Medicine at the University of Calgary, and she is an active consultant to healthcare and policy organizations. Her areas of expertise are consumer patient-reported outcome measurement and health system performance measurement, primarily in the mental health and addictions and health services space for children and youth, seniors, and vulnerable populations. I would also like to introduce Christopher Canning, Manager of Policy and Research here at the Mental Health Commission's Knowledge Exchange Centre. Before Dr. Élaborer gives her presentation, Christopher will provide a brief overview of the Commission's involvement and contributions to advancing conversations on data, indicators, and performance measurement in Canada over the last number of years.
Thanks very much, Brandon. It's really great to be here today with my colleagues from the KUC and Dr. Élaborer. We're sincerely glad that you could join us and hope that you enjoy this informative webinar. As Brandon mentioned, we would like to formally acknowledge a lot of the work that came before us here, especially contributions from people with lived experience, subject matter experts, organizations like CIHI, the Public Health Agency of Canada, the Canadian Centre on Substance Use and Addiction, Statistics Canada, and provincial and territorial authorities. And all of these folks have made really great contributions to data-related initiatives. However, as we're going to go on to explain today, some of these initiatives have contributed to commendable progress, but sometimes they've been relatively disconnected because there has never been a shared, comprehensive framework for mental health and addictions in this country. So last July, the Knowledge Exchange Centre contracted a team of researchers led by Dr. Adair to begin the process of thinking through these processes for developing a pan-Canadian framework for measuring. This work is captured in our new report and is the focus of the following webinar. Thank you again for joining us, everyone, today, and we look forward to continuing the conversation. I'm going to pass it over to Carol.
Thank you, Christopher. So I'd really like to start by acknowledging the small but mighty core research team, which was myself, Janet Durbin, Elizabeth Lynn, and Frank Saradich, and of course the team members of the Mental Health Commission on this project. Christopher just heard from Lara De Tomaso, Francine Newts, Nicholas Waters, and just a nod to Brandon as the new member of the Mental Health Commission team working on this file. So we also really want to thank our 20 subject matter experts. They're listed here, I won't read their names. But what did we mean by subject matter expert? We were looking for people that had both a background in mental health and addiction services and policy of some kind, in addition to data and measurement expertise. And that is not a big community in this country, so we were really fortunate to have these folks give us their input. And in this group, there are also people with lived experience of mental health and addictions and family members. So just some main messages to start off the talk today. We see that there are still big challenges in measuring performance of mental health and addiction systems. The initiatives are still fairly fragmented, but as Christopher alluded to, and I'll talk to you a bit more, there has been encouraging progress. I mean, there are committed players at the federal, provincial, and territorial level that have made complementary contributions. The provinces and territories have policy priorities, frameworks, and we've also identified some exemplary processes that can inform a collaborative way forward. And we'd like to make the case today that we are ready collectively for a pan-Canadian mental health and addictions performance measurement framework. So what I'll go over in this talk is I just want to touch again briefly on the history of performance-related initiatives in Canada so that we can situate this project in with the others and acknowledge the others. I'll also go into very briefly what we did, a few highlights of what we found because it was very extensive and we'll only be able to offer a few things to you today, and a little bit about what's next and what our team's vision is for going forward. So first, the context. Really an organized call for better mental health data began with a workshop that I actually attended, as well as Francine here in the room. And it was hosted by the Public Health Agency of Canada along with the Collaboration for Addiction and Mental Illness and Mental Health. And there was a call there for better data. Over the period of 15 years following, there were some resource kits developed. StatsCan initiated the first Canadian Community Mental Health Survey, Canadian Community Health Survey for mental health. And then the Senate Committee had the Out of the Shadows report. Public Health Agency began surveillance of major disorders via the Canadian Community Chronic Disease Surveillance System. The Mental Health Commission in 2009 and 2012 posted the framework for a strategy as well as the strategy for Canada for mental health services. And two tracks of work going forward on data were identified in the strategy, which I'll speak about in a moment. And then there was also work by CIHI on some reports, also the CCSA, the Canadian Centre on Substance Abuse, did some work on treatment indicators for addictions. Now, moving to more recent work, again, we had another Canadian Community Health Survey, version 1.2 on mental health in 2012, which allowed some comparisons back over the 10 years. The Mental Health Commission began to work on an overview of mental health data, like what all data sets were available. In 2015, again, the Mental Health Commission led an Informing the Future project, which identified 55 pan-Canadian indicators, most of which could be reported out at the national or at the pan-Canadian level. Public Health Agency in 2016 did some excellent work on positive mental health indicator framework. And in 2017, the Graham Beck Foundation funded a group of researchers across 5 provinces to see if common definitions could be determined for 6 indicators, and that project, we did manage to do that. More recently, CIHI, in the shared health priorities with the provinces under the health accords, identified 6 indicators of access to care to be reported out by the provinces and territories. And finally, the work, again, over 2018, the current work that we'll talk about is focused on resources for developing a framework. So, the current project. Moving again to the mental health strategy for Canada, there were 2 tracks identified for development of data and performance. The first one is identifying an initial set of indicators to track progress, and you saw that on the previous list as the 2015 initiative Informing the Future. The second was developing a framework for reporting on outcomes over the longer term. So many of you will recall that the strategy was an extensive consultation about the direction for services in Canada and priority areas for reforming the Canadian healthcare system. So there was this emphasis on data in there, and that was quite an extensive consensus. But at the outset of this project, we still had some key issues. So as you know, we've got enormous complexity in mental health and addiction services. We've had no single organization with the lead responsibility for mental health information and data. There's a lot of confusion among the players about who should be doing what, the roles, at what level initiatives should happen. There's generally a lack of shared understanding amongst the stakeholders. And we noticed particularly a lack of connection between existing indicators and policy directions, both policy directions from the national level in the strategy as well as provinces and projects that have been done elsewhere seem to lack this connection. And this is a really strong message in the literature about the importance of connecting to strategy or policy. So we also had seen lots of this prior work where projects just start, cataloging a whole bunch of indicators, and then there are a variety of ways to choose the indicators, but mostly they're chosen based on what's existing or what's available. We call this an availability bias, and it has some unintended effects in that it tends to focus on what is in the past, or it tends to focus on formal parts of the service system, acute care, often services for adults. And it's very uncommon for these projects to actually get to the development of new aspirational indicators that show the way forward. And again, as I mentioned before, indicators aren't well connected with the policy direction. So it's sort of like the tail wagging the dog in choosing these indicators just because the data is available. And it's also getting increasingly impractical. And if you catalog indicators, you'll find they're already in the thousands for mental health and addiction. And this has been sort of characterized as indicator chaos by this summit that was held in Saskatoon with the Alberta, BC, Saskatchewan, and Canadian Patient Safety Institute. They held a summit on how to deal with indicator chaos, and they said, there is broad agreement at the summit that indicator chaos is a symptom of the increasing commitment to improvement and measurement from all sides, provincial systems and organizations at all levels, because of their lack of coordinated priorities and planning. So our rationale for the project kind of stemmed from that. We wanted to turn this around and look at what policy priorities are held in common what frameworks were available that would potentially inform a framework, and then only much later consider how to choose indicators. We also wanted to draw in the knowledge and practice that's available in Canada more deliberately, more comprehensively, especially really good provincial territorial work that has not been in much of the parlance lately. So our practical questions were, what information, tools, and resources are needed to inform the development of a pan-Canadian framework? And again, I want to emphasize that we were not developing the framework in this project. We were finding the resources that would inform it. Where is there common ground in the provincial and territorial policies that could inform framework development? What can be learned from existing provincial territorial frameworks that are already developed or in development? And also, what can be learned from systematic framework development processes? Finally, we wanted to look at what indicators are being aspired to or being used in provinces and territories, and we did catalog them, but we set that aside.
So I'm going to double check. And
is everyone okay in terms of the volume? Okay, we'll just continue on. So now I'll talk about what we did. And again, the focus was on systematic compilation of resources. We saw this as something like fueling the ultimate framework, which is the metaphor of a balloon. So in brief, and there's a lot of details on the methods in the report, but I won't bore you with those. We did systematic rapid review methods to pull the latest research on mental health and addictions performance measurement, including national and international gray literature. We did systematic search and consensus selection of policy documents and frameworks across the country. We had key informants validate that we've captured the right documents. And then we coded the policy priority areas, and I'll say macro and micro, meaning the high-level priorities in these documents as well as the lower-level priorities. We had 2 members of the research team do validity checks on my initial coding of all these documents. We looked at the alignment with the strategic areas with the mental health strategy for Canada. We tabulated the features of provincial territorial frameworks, and we described the features of the processes. Then we sent out all this information to 20 subject matter experts, and we selected them in terms of what I already mentioned, but also in the major policy priority areas that we found, and we gave them standard questions to answer about the premises in the report and the content in the report. And then we incorporated all of that subject matter expert input. So what we found, and again, this is very much in brief. Go ahead. So our core material were these foundational pan-Canadian documents, especially the strategy, the recent peer review literature, 19 provincial and territorial mental health and addictions policy documents, 10 frameworks, and 5 what we call exemplary processes. Here's the outline for the report, and I want to apologize for the length and depth of this report. But it was really never intended to be like a quick general audience document. It was meant to be a clearinghouse of all the ideas and concepts and input we gathered together, like a resource for any and all partners and players who might work in this space going forward. But the report's also organized as initially making the case for a framework. Why would we do it at all? And then the content is organized by the 5 steps of framework development, which were informed by the literature review. And we end with insights about systematic engagement processes that came from the ones we found that could inform the work forward. And also we reviewed issues around how do you get from just a framework and actually move toward a full system. So this first section on making the case for a pan-Canadian mental health and addictions framework, we proposed a few things to subject matter experts, and they added to them. And this is the list of benefits that we came up with. So first, to define the scope for measurement of such a complex service system, to articulate a system vision that ideally aligns with policy, to ensure balance across sets of indicators and protect against the unintended effects of indicators that are too heavily weighted in one area, too backward-looking, that kind of thing. The framework would help clarify the relationships among indicators and in particular making gaps evident. For which populations, which kinds of services is there very poor measurement? It helps us understand that. To specify complementary roles and responsibilities. We've got many entities, organizations working in this space, doing little parts of it. It would be nice to see how we could all work together and specify roles and responsibilities. To define the appropriate level of the system for specific types of measures, and I'll speak to this a little bit more in a minute. To allow provinces and territories to benchmark with each other. And you know, this is quite important. We're hearing from some other systems that to share know-how and capacity across partners. I mean, really, as I mentioned before, there's only a handful of people with this expertise in the country, and it's concentrated in a couple of provinces. And it makes sense to us that that capacity would be shared amongst all Canadian partners. So now I'm going to just give you a flavor for what the subject matter experts said to us on this making the case. And I'll follow this pattern throughout most of the rest of the presentation, where I'll talk about some of the concepts that we presented in the various stages, and then what the subject matter experts had to add to that. But I have to caution that I've just pulled out 2 or 3 example comments from the subject matter experts. They're actually more extensive in the report. So in terms of making the case for a pan-Canadian framework, 95% of our subject matter experts agreed that there would be added value of a pan-Canadian framework. Good consensus there. Some of them noted, though, that perhaps it should be based also on population needs and also values of stakeholders, not just policy, because we have to keep looking forward. And sometimes there isn't exact alignment of policy with advancing forward. Then we heard from several subject matter experts that, you know, the complexity of the system, you have to stop apologizing about the complexity of the system in mental health and addictions. It's actually not the principal barrier in their views, that it's more about the collective will to tackle this really difficult area and to invest in it to make it work. So, moving to the first step of the 5-step process that we proposed. Actually, this step we had as the 5th, and our subject matter experts told us, no, wait, this is the most important thing. Get to acknowledging the key issues. So here are only a few of the key issues. There are more in the report. What is the ultimate purpose of performance measurement? Will comparisons be fair and take local conditions into account across jurisdictions? Will there be sufficient capacity to support action on the results? Whose performance will be measured? And for this one, our research team kind of wanted to take a shot at answering whose performance we thought would be measured. And our contention was that we are all responsible for mental health and addictions in Canada. We would be measuring the performance of the Mental Health Commission in shifting policy, including the impact of the strategy and other work that's gone on since. We would be looking at the performance of provinces and territories in reforming their delivery systems. We would even be potentially looking at how communities and individuals are doing in changing attitudes and supporting those in need. And finally, how are we doing as a society and a country? Of course, those questions need to be answered in a systematic consultation process, but we see this as sort of jumping off points. So what did our subject matter experts say about recognizing and acknowledging key issues? Some other issues they brought up was who will lead this and who will fund framework development? Who will benefit most and least from such a system? How will buy-in be achieved? And how will the quality of the work be assured? And again, we have some ideas about these things, but we don't want to preempt stakeholders' ideas in future work. So the second step to developing a framework, and of course it's an iterative, complex process, so this is a little bit, reduced, it's a bit simplified, but just for the sake of following, the ideas. The second one is to cultivate a shared language, come to a common understanding of key concepts. So we know that working definitions are needed for mental health conditions, health statuses, positive mental health, all these things. Also mental health and addiction services and systems and the broader support system. We have lists of these that we think need definition in the report. I won't speak to them directly, but I did want to talk about some performance measurement related concepts themselves that need to be defined. We have used some working definitions, and again, we don't claim these to be the perfect definitions, but it's a place to start to share understanding. So what is performance measurement itself? Well, we contend that it's a use of information to assess change in response to an intervention, and that intervention can be a policy, a practice, that sort of thing. So as distinguished from just descriptive information that is not connected to any intervention. That might be called surveillance or just descriptive population information. So what is a performance measurement framework then? So we are characterizing that as a conceptual structure which would ordinarily have several domains or dimensions or components. It would be a tool for conceptualizing and categorizing indicators to ensure balance and for planning the measurement process. So it's a way to bring everyone on the same page in terms of understanding how indicators fit and which indicators fit where. So what is a performance measurement system then as distinct from a framework? So we see that as the capacity for ongoing reporting and processes that to take collaborative action to change the indicators ultimately. You want to change the system such that the indicators improve. And you know, there is some controversy about this concept. In many spheres, people propose that, you know, information is just out there, it should be presented, and then it's up to others to take action. But we've seen some really good recent systems, and we believe that you know, there isn't a lot of benefit from a framework if you don't actually get to changing things. It's also important to emphasize that we're not talking about a single computer system in all services across the country. That is not necessary for a performance measurement system. It is possible to draw from existing surveys, existing clinical systems, existing you know, national systems like CIHI databases and so on, as well as to develop new indicators and potentially in collaboration across provinces develop some ways of collecting data. But it's not, and I emphasize again, a single computer system that everyone would have to punch in all their information. So the last definition I just want to talk about here is what is meant by system-level performance measurement framework. So we talk in the report about multiple levels of measurement, and the focus for a pan-Canadian framework would be at the system level, the population level. So really high-level indicators that tell us how we're doing as a society, you know, a large population. It's not about things like payer-provider accountability mechanisms. Sometimes organizations do have to provide some measurement to show that they would get their funding. That's not what this is about at all. It's not about program or service level QI processes. So for example, we would not consider something like a rare safety incident on an inpatient unit as being appropriate for a system level performance measurement framework. That's more appropriate for local quality improvement processes. So there are these distinctions in what level an indicator is most suited for. And it's not really about individual outcomes, although I need to qualify that sometimes you can roll up individual level data to the program level and even higher if you have the right set of measures and the right tools. Not many of them would be possible at this point in our view, but that's the way we explain or think about the levels in a performance measurement framework. So the second step in developing a framework is this cultivation of shared language and trying to reach common understanding. Here I'm not talking about what was in the report other than the definitions I just mentioned. But here's what the subject matter experts said about this issue. There was lots of consensus where they said shared language is critical, but actually shared principles and values are important. There is this movement towards principles-based measurement, which is really coming to the fore and interesting. And they said stakeholders need to be able to put forth additional concepts, especially people whose views of mental health have not been well represented to date. And we'll do more of that in a minute. So the third step is to begin to put bounds around what is in and what is out in the performance measurement system. There are various models of mental health systems with different levels. There are tiered models, there's stepped care, various things discussed in the report. We call that the vertical scope. And then there's the horizontal scope, which is how broad across total continuum of services, including determinants of health, population health model, health promotion and prevention, how far do folks want to go? And when you see later when I put up the slide on what the policy priorities are, you will see that most of the provinces and territories are going very broad with their policies. And then there's a bit of attention to temporal scope, so the timelines for expected outcomes in your measures, timelines for reporting, those kinds of things have to be considered. So what did the subject matter experts then say about what we had to say about the boundaries and the scope? We got a lot of input noting that any discussions about scope in a future framework development process need to attend meaningfully to some important areas. Now, I'm not saying these are the only important areas. There are many. But these three really came up strongly. So children and youth, mental health and addictions, and some of the subject matter experts with depth of experience in this area suggested perhaps even a separate framework would make sense for children and youth. Not everyone agrees with that, but it is something that would have to be determined. Substance-related problems and addiction services. Well, there's such a strong movement over the last decade and longer in some locations in the world to the integration of substance-related and addiction services. So that came through strong from our subject matter experts as well. There's no going back on that one in most people's view. And of course, Indigenous peoples. We must honor the principles and processes of reconciliation and meaningful engagement. That includes the right to lead relevant parts of a framework or even do something separate. And there's some very good work in the country in the area of data. And I want to just make note of the OCAP principles, which have been developed by the First Nations Information Governance Center. And these principles talk about First Nations ownership, control, access, and possession. That's what the OCAP stands for. And so you can find out more information about that at the link below there. So the fourth task then is to finally get to defining the key dimensions and domains. And this is where, there is other information in the report, but this is where we thought that the policy priorities and the frameworks could provide some interesting starting points. So here are just the top 9 of 24 policy priorities in those frameworks, in the policy documents from the provinces and territories. 11 of the 13 documents had access as a macro priority. So that's like their big picture priorities. 10 had promotion, prevention, early intervention. That speaks again to the breadth of the service system that folks are talking about now. Children and youth ranked 3rd, along with needs-based person-centered care. Indigenous people by 7, ranked 5th. And then closing gaps in integration, collaboration across boundaries, and so on. And we also tabulated all the micro-level priorities, and we divided them as service priorities and person-related priorities, and that's all available, but I won't speak to today any further. And it was interesting that in terms of service system, 11 of the policy documents included addictions, and I'm aware that subsequently another province has also moved forward, including addictions. 11 of them included this population health approach. And we also looked at how well the priorities echoed the strategy. And it wasn't perfect, but you can just see some of the themes there, that there certainly is some reflection. So now turning to the performance measurement frameworks, we found 10 in 6 provinces listed there. They were very different. There were few concepts or dimensions or domains held in common at all. We weren't discouraged by that. We think there's richness in diversity. Each had unique features and strengths, so some of them were very strong on administrative data, others used a mix of data. Half of them explicitly included substance use problems and addictions, and half mentioned the importance of equity, and that came up in a few places. Just in terms of a particular strength, I'd just like to highlight the work in Alberta on development of a 3-pronged performance reporting model, which includes qualitative and quantitative components. It's a quantitative report card with indicators, a component with qualitative stories of people's experiences, and a set of principles-based learning projects. And I'm sorry I can't give you more detail because it's quite excellent, innovative work. But that's just one example of how we can learn from a partner in a province about how to do things well. So what did the subject matter experts then tell us about our thinking around performance measurement frameworks? They said, if you draw too much from these past frameworks, you might result in a non-progressive framework. So be careful about relying too much on what's been done in the past. Some offered our advice to broaden the searches to find more Indigenous and equity-seeking groups-related work, and we have done some of that work. We found work in Australia, we've got a much richer set of citations around Indigenous peoples and related matters because of this input. And then we had the subject matter experts express a few of their thoughts about what domains were important. And one thing that was said was, you really have to make sure your performance measurement system measures the ability of the system to respond to changing needs. How mobile is the system? How spry is it? Or is it always stuck in the old pattern? And then also person-centered services that came through loud and clear, including involvement of people with lived experience. So finally, the 5th step, and way down at the end here, we're saying select indicators. When we look into the literature, there are lots of ways to select indicators, and usually they're selected without a framework, I might note. There's ad hoc, where just whoever's working on the project just decides what they will be. There's consensus expert panel, with or without explicit criteria, and I want to put quotations around experts because ideally an expert panel would also include expertise of people with experience, communities, not just academics. Many times there are systematic ranking methods used. I'm sure many people have heard of Delphi approaches, either Delphi's with experts or Delphi with broader stakeholders, or multiple rounds. There are multiple ways of doing that. And then there are even more complex concept mapping approaches where you try to get at meaning to people and to services and try to map those onto what your indicators you might want. There is really no consistency in how to select indicators or the criteria to select indicators. So our learning from that is the selection criteria themselves need to be part of the stakeholder consensus process. So our subject matter experts on the issue of selecting indicators said, there's actually a few of them said, we've got indicator fatigue. We are so tired of a lot of talk about data and information and indicators in this country, and some action, but not really advancing as far as we'd like to see. People complain that traditional indicators are not visionary. We need more aspirational indicators. We need to move from process indicators to outcomes indicators. And just for those of you who, this is jargon too, an example of a process indicator is training all your staff in trauma-informed care, for example. Or wait times is a classic process indicator. It's what's happening to the person in the service. Versus outcomes indicators, which are about how the person does as a result of the service and other interventions. So is their quality of life improved? Have their symptoms been reduced? And actually, is their functioning better? Are they back to school? Are they working? Are they, the things that their aspirations, have they achieved them? And families and people with lived experience will tell you quality of life matters to them more than things like symptom change. Our subject matter experts also told us more indicators based on the voices of people with lived experience, and they were very strong about existing indicators fail Indigenous and other equity-seeking groups. They need to design and lead their own processes or co-design processes with others for culturally relevant indicators. We also had some subject matter experts indicate that indicators for children and youth need to cross systems. But looking at the policy priorities, it's pretty clear that indicators for adults and youth and seniors also need to cross systems. So we also, as I mentioned, searched for some development processes that we could draw some learnings from. We found 5, and I won't read through all the detail here, but I would just acknowledge, Lynn, Warich, Waddell, Mulvale, and Orpana in the last decade who have done some really interesting projects. So for example, the indicators in Lynn's power study, depression module, started from a discussion of the most meaningful care issues to people receiving care, and then they moved to a Delphi process. Warich's project in 2010, looking at quality measures for primary mental health care, used multiple stakeholders, multiple jurisdictions, multiple Delphi rounds to come to consensus. Waddell, in 2013, in British Columbia, developed a conceptual framework based on theory and a population health model, and reviewed the set of indicators that were existing for meaningfulness, actionability, and identified several gaps for children's and youth indicators. And Jillian Mulvale and her team worked on a child and youth mental health and addictions framework for the Yukon. Now this one is actually a service framework, not a performance measurement framework, but some of the processes that team used with 3 phases of document review, interviews, and this really rich deliberative discussion, really has some lessons for us. And Heather Orpana's work in 2016 at the Public Health Agency of Canada had some real strengths in starting with identifying related frameworks for positive mental health and then defining key concepts followed by Delphi rounds and lots of consultation with stakeholder groups. So we put those 5 to our subject matter experts as well as we asked them to tell us what they thought about what are exemplary development processes. And they said meaningful engagement is paramount, including youth. Including youth in the process has positive outcomes in its own right. Any work must be co-designed, participatory, culturally safe, with a reflection on the participants' assumptions and biases throughout. Success would require excellent communication, a reasonable amount of time and resources, and the focus should be on innovation and transformation, not just simple performance. So this whole issue of how do you get from that conceptual framework, which is a piece of paper with some concepts on it and maybe a nice diagram, to actually a system. So we are contending that indicators on a one-off report are not enough. The capacities, the infrastructure for repeated measurement, reporting, continued consultation and engagement, collaborative action on results are essential to realizing the promise of performance measurement in mental health addictions in Canada. We had strong agreement from our subject matter experts on this point. They said the mechanisms to actioning, the infrastructure, the technical capacity is all critical. Getting from the framework to system would require strong leadership and collaboration. And they reminded us and others that any system needs to evaluate and report on the quality of its own processes and the value of its own contributions. So in the course of this work, we had an opportunity to look at one possible model of a full system. The Canadian Partnership Against Cancer has developed 37 indicators in 8 healthcare domains. They started out with indicators in disease areas, but they've moved to prevention, screening, diagnosis, a person-centered perspective, long-term outcomes, and it's really broadened nicely. These indicators are reported by province and territory. The provinces and territories don't submit data for all indicators yet, as they're in development, but most of the provinces submit for most of the indicators, so they can benchmark with each other. This was all developed through systematic collaborative processes grounded in policy, meaning the cancer control policy of Canada. This group has shared understanding and definitions. They use multiple data sources. They have collaborative action. They get a network together to talk about how they can actually improve. And they have, I will acknowledge the cancer is not quite as complex as mental health and addiction. They have some advantages. They've got case registries enshrined in legislation. They have, a bigger budget. They have a national cohort study called the Tomorrow Project. We don't have those things, but we think that actually the more complex the system is, the more important it is to have a framework. So we asked the question near the end of the presentation here, is something like this possible for mental health and addictions? And I just want to back up and encourage you to click on the link and look at what's online, CPAC has online, and the different domains and what they're actually reporting out. It's quite impressive. So is something like this possible for mental health and addictions? Well, we have so many diverse stakeholders. Our complexity is massive. In mental health and addictions, unlike many other patient service areas, many people with these conditions aren't even receiving services in the first place. So it's really hard to capture data on people who are not even in the system. It's not impossible, but it's hard. Most existing data are not comparable, but in our recent project with the 5 provinces and 6 indicators, we were able to hammer out definitions for those 6 indicators that everyone agreed to. They're not necessarily the most important 6 indicators, but we wanted to test the process and see if we could come to agreement, and we were able to. There are other reasons to be optimistic. Some of the informing the future indicators we understand can be reported by province. We've got good information already in hand. We've got a lot of players in Canada that have complementary contributions and expertise that if we could just harness collectively, we'd be in good shape. There's greater policy recognition of the importance of mental health and addictions federally, as we saw in the Health Accord, and in provinces and territories. Mental health and addictions, is really finally coming into its own in terms of importance. And actually 12 out of 13 of the provincial territorial policy documents have actually enshrined a commitment to performance measurement in their policies. So we are hopeful, and we feel that this is doable if everyone works together and if we follow meaningful processes. So it looks like we have a few minutes for some Q&A, discussion, and advice, and we want to acknowledge the many great questions that were submitted prior to the webinar. Unfortunately, there were too many to address in this short webinar, but we have decided that we would like to answer your questions in written form and circulate the answers sometime in the next week or so. But we can take a few now. So we have one
So Phil Troy, I see he's typing right now too, but he did ask a question that I think you answered somewhat when you're talking about performance measurement and the distinction between outcome measures. But perhaps you can clarify again, what is the difference between performance measures and outcome measures in the different levels?
There isn't 100% agreement about this. You'll often see performance measurement is the all-encompassing category, and within that you can have structural measures, process measures, outcome measures. That's one framework of conceptualizing it. Outcome measures are only one type of performance measure. Other people actually equate performance measures with process measures. So I'm sorry that I can't be more definitive, but there are many definitions and many differences of opinion about what you define. I think what's important is if you embark on something like this together, you come to agreement about what you're going to call the various terms, and everyone is on that same page. But I should just actually digress a bit and say that when I talked about defining the system, I meant to say that all of the players, i.e. provinces and territories and federal agencies, do not have to have the same service system. They just have to have common understanding about, in the performance measurement framework, what's in and what's out. We're not suggesting everyone have a tiered framework or everyone have a stepped care service system.
That was the point you made earlier about defining the scope, right?
Yeah.
Yeah.
That's great. Well, thanks so much, Carol. We'll just give it a minute or two to see if there's any other questions that are rolling in. Otherwise, we can answer some of the questions that were posed during the registration process. No questions so far. Thank you.
Maybe one question I'll address. As Brandon said before the webinar, we sent out a question to see if folks had questions in advance, and one of them that came back was, do you have a sense that the provinces are open to accepting a pan-Canadian framework? And I would say in our early conversations with stakeholders from across the country and in consulting with our provincial territorial advisory group, I think there's great interest in having some sort of consensus-based pan-Canadian framework. The reasons, as Carol pointed out, are pretty broad, and I think what we heard in this process is that at least we need a process to coming to a framework, but that a framework is needed. So I think what we tried to do here is be careful not to say what is needed in a framework, but I think provinces and territories agree that a process to coming to a framework would be a next logical step. So that's what we're hearing.
What has been observed in some other systems we looked at is that provinces and territories actually see a benefit in the capacity. There isn't a lot of this expertise in Canada, and I mentioned earlier, it's something that can be shared, and that, it turns out, has been a great motivator for particularly provinces with smaller populations and smaller budgets to get into this kind of technical work. We're better together to share and to learn from what's happening on the ground in those stations. Okay, there is a question here from Babita Gupta. It is, you mentioned that there are people you can't even measure because they're not in the system. How do you propose getting information on them? What do we do about a lack of infrastructure for data on mental health and addiction? Well, actually, the Canadian Community Health Survey, which is a population-based survey, has some limitations, but we've got data on people who self-identify or meet diagnostic criteria for need for mental health care. So we can actually measure, using survey methods, the difference between those who say they've received care and those who have those conditions but say they haven't received care. So that's a little bit of a simplistic way of saying we need survey data, we need clinical data that comes out of clinical systems, we need all kinds of data, administrative data. At this point, they all have weaknesses and strengths. but we also can develop new survey questions for particular indicators, and we can get very creative about doing tapping what's going on in the population.
I see a question here about how do you define youth. That's from Phil Troy.
Yeah. Good question, Phil. Personally, I follow all of the progressive work on youth transitions to adulthood and believe that the extension of youth should be defined into the mid-20s, if not upper 20s, because of the changes in society, in work, in transitioning to adulthood. I have seen recently that many indicators, particularly international indicators, are still defined as 18 as the upper age limit. But I think it's really important to consider the transition age youth as broader.
The Mental Health Commission has done a bit of work over the years on the emerging adult population. We hosted a consensus conference in 2016 to explore this issue on the definition of youth and service system needs and policy needs for young people. So it is available on our website. It's called the Consensus Statement on the Mental Health of Emerging Adults, and it does go into this issue very in detail, so I would encourage you to look at that. And like Carol said, I think the system in Canada, especially with the integrated youth services that are popping up across the provinces, are looking at the definition of youth to include anywhere between the ages of 16 and 25, or in some jurisdictions as old as 29 or 30.
Great. So I see Leah here posted a link to performance measurement framework example related to stroke.
Oh.
So I encourage folks on the line to check that out as well.
Thank you, Lee. That sounds really interesting.
Getting some thanks about the webinar. Are there any other questions from the audience before we wrap up today's session? As we mentioned, we will be posting some written responses to some of the questions given.
Yeah, if you think if something is burning in the next, 24 hours, it just occurs to you after, please feel free to email us as well.
And our email addresses are up on the slide before you. So I think we'll just wrap it up. I just wanted to thank everyone again for joining us today. We will have a follow-up survey sent to you, so please let us know how we did in our webinar, if you liked it, if it was helpful or informative. We're always constantly wanting to improve our practice and the way that we carry out webinars, among other things. And as I mentioned at the beginning of today's session, we will also be posting the recording up on the website. Thanks so much.